A life science supply chain is regularly tested every day, and the complexities that exist are global in scale. We began our partnership with Kinaxis about 4 years ago, right during the height of the pandemic. We had started the pandemic with, again, a lack of visibility with our inventory, a lack of our ability to scenario plan in any meaningful way without conducting weeks of analysis. And really, we had a need to be able to respond faster. And so our relationship really started out of a true need of our customers to be able to plan their organizational work, their surgeries, their procedures without threat of a disruption. Out of the pandemic, we were led to Kinaxis because of their AI-enabled capability to be able to conduct scenario planning, as well as orchestrate inventory across our entire ecosystem. We were called upon by our strategic relationships within the health systems to be able to perform at a higher level of service. In order to do so, we needed to act fast, and we needed to make decisions as fast as we could. So again, switching from a reactive Cardinal Health to a proactive Cardinal Health.
You know, we're just thrilled to partner with Cardinal Health. I mean, if you think about what Pete outlined, speed is the new currency. Companies have so many vectors of nodes and decisions, and as Pete outlined, his strategy was end-to-end. It was inventory, it was capacity, it was materials. And companies like Cardinal Health would be able to drive scenario creation, but also understand the impacts of demand changes in the supply, and when there's supply issues concurrently on demand. And as a forward-looking organization, then layering on advanced agents and AI capabilities to take that to another level. So just thrilled and honored to work with Cardinal and Pete's team.
Kinaxis' approach was really a shared ambition. And we had not found a company like Kinaxis that really truly wanted to impact the life science community in the way that they wanted to. When we started talking to Kinaxis, they wanted to be healthcare's most trusted partner, just like Cardinal Health does. And with that shared ambition, we were able to create a really strong platform. Now, most of our platform's out of the box, but when we needed to make some changes to be able to support the life science ecosystem that we operate in, we needed Kinaxis' help. That shared ambition, that shared relationship really enabled us to pull together a system that has changed how we do business. Kinaxis' biggest impact to our segment has been twofold. One, with service level. So our service level increased from the height of the pandemic dramatically. And we're able to service customers and plan at their individual nodes in a way that we've never seen before. Second, we were able to get our inventory in line and really ensure that we had the right inventory at the right place to be able to service customers when and where they needed it.
As you heard Pete outline, so many other use cases in terms of AI and agents. And it's not about replacing humans. It's about supporting the planner and the function because of all of the requirements to scale, to drive better, faster decisioning.
Our ability to change and alter the way that we conduct our plan has changed dramatically during the innovation work that we've done with Kinaxis. We have been able to create advanced scenario plans that are reviewed within hours by our executive staff to make decisions with true data that is backed by really well-supported algorithms and other types of information that we could not get within a 1 or 2 hour period before. We can have planners come in and ask to do a scenario, and by the end of the day, we can execute that scenario so that our manufacturers, our contract manufacturers, and our own source products can make it way to the customers when they need it.